This is pharmaphorum web editor Nicole Raleigh, and I am stateside in Chicago for ASCO 2025. And with me today is Biljana Naumovic, president of US Solid Tumour at Johnson & Johnson. We are at the city's well-known Willis Tower. You'll probably see the view behind me, or perhaps not, following J&J's exclusive panel discussion, which unveiled its Breathtaking consumer campaign to elevate awareness of the lung cancer patient journey and demonstrate how life is more breathtaking than lung cancer. Pleasure to speak with you, Biljana.
Pleasure to speak with you.
So today's event showcased what can be undoubtedly described as powerful patient stories through a panel discussion, including lung cancer patients, survivors, advocates, and yourself. And we heard how patients and their loved ones are quite literally cherishing life's most breathtaking moments despite receiving that dreaded lung cancer diagnosis. So I was wondering if you could describe for viewers more about the significance of the campaign as discussed today and Johnson & Johnson's commitment within the lung cancer space.
Yeah. Thank you for the question. Thank you for being here as well and witnessing this. For us, this campaign represents the start of support for the patient voice and empowering patients to take hold of the things that could happen to them, get knowledgeable, get support, get into a community, whether it's through the patient organizations or anyone who could actually help them. And you've seen a lot of organizations who are doing that. And what we want to do, apart from being a pharma company who brings great medicines and to patients, and we're always going to be in front of that research, we want to be a conduit that supports creating that community and bringing breathtaking moments, bringing hope. You've heard some of us have been in lung cancer for decades now. And since beginning of 2000s until today, we moved from hopeless to hopeful. And there is promise that more can be done and will be done for patients and their families with lung cancer. So every single moment counts. Every single we do for one another counts. And moments like this in Willis Tower on the spectacular view allows us to dream bigger together and think of the things that we don't have maybe today, but we could have tomorrow.
I like that. Conduit for community and hope and dreaming bigger together. They're going to stay with me after this. So cancer treatment, it's fair to say, is advancing at an unprecedented pace. And new therapies, AI-driven diagnostics and biomarkers are quite literally revolutionizing care. But 76% of HCPs are saying that the relentless pace of new treatments is overwhelming. So with increasingly complex guidelines, shifting treatment paradigms and disparities in access, as was discussed on the panel today, oncologists are working harder than ever to bridge the gap between innovation and real-world patient care. And so Johnson & Johnson has launched the Oncology Care Index, and I have been provided with a poster presentation as well. And that is a comprehensive survey of 500 US oncologists, urologists, and advanced practice providers, or APPs. So Biljana, in brief, can you share why this survey is of such importance to the industry at large?
I think it's important for the entire healthcare community, because if we're going to progress anything regarding the treatment of cancer, it needs to come to patients. Having advancement in science that we talk about on meetings like ASCO and them going nowhere is of no help. So from bench to bedside. And that to bedside is becoming way more complicated, because our research is getting advanced, and we are, like you said, the innovation is in such a high pace that last year alone we had 15 new indications being approved, 11 new NMEs in oncology. You open that clinicaltrial.gov today and you'll see tens of thousands of studies being conducted in oncology. No human being is able to keep up with the pace of that. So if we are going to lead where medicine is going, and we are a company that has a vision of transforming cancer and calling it a thing of the past and making it a chronic disease if we can't cure it. We need to be able to bridge the gap between that research and how it gets to physicians and to patients. And that's what we're doing. This survey was done to uncover some of the topics that are most cumbersome, be it the speed of innovation and inability to bring it to the patients at pace, be it the connectivity of care, because patients don't see just one physician or one institution, they see more. And they will see more as lines of therapies progress in various cancer types. So we need to connect. We need to bring that care for the patient seamless, which is not necessarily the case all the time. And there's also this moment of AI hype, of what AI can do for us, but we need to understand it. And if we don't understand it, we will not make great use of it. And our data systems have to be connected to do it the best. And then the ultimate thing that we did see and hear from the research is about the ability to bring clinical research to more broadly to in the community setting and allow patients to see all the benefits of clinical research in the United States. So these are the topics. We have great thought partners to have these topics with. We certainly don't think that we have all the answers for the challenges ahead of us, but we would love to have discussions on how we bridge them together. So it's a great moment to use during ASCO and after ASCO, because we are all here and we can talk about things that are system issues that are not just around a therapy per se. And we believe that if we support system issues, we will support patients.
Exactly. Well said. Very well said. Okay, so finally, you've placed it within the context of ASCO. We're speaking as ASCO officially kicks off today, so it's quite early. But what are you looking forward to from the Congress this year in relation to everything we've been discussing today?
Community, connectivity, idea sharing. Of course, hearing the research and what is happening that is going to be presented. Abstracts are already out, so there's a lot of buzz and things. What worked? What didn't work? Why didn't it work? And like in every research you do, you don't start with unknown. You start with an unknown, and sometimes things don't pan out. But that's what I love. My expectations of the meeting like this is always to have more connections, more ideas. Start having projects that spark out of a Congress like this, and that always happens. So it's a great melting pot of future that we're building together. So that's what I'm looking forward to.
Absolutely, the sparking conversations to move towards this future breathtaking moment, perhaps.
Future, there you go.
There you
exactly,
go.
Absolutely.
Pleasure speaking with you, Biljana.
Pleasure
Thank
speaking
you.
with you. Thank you for having me.